va commencer. Bonjour tout le monde. Hello,
Good day,
everyone.
everyone.
Merci d'être avec nous.
Thank you
We
for being with
apologize
us.
for the delay. We obviously wanted to allow the state funeral for the Right Honorable John Turner to conclude. So thank you for your patience. I'm joined here today by my colleagues, Ministers Hajdu and Anand, and of course, Canada's Chief Public Health Officer, Dr. Tam, and the Deputy Chief Public Health Officer, Dr. New. J'aimerais commencer en soulignant
I would like to
que
start
l'application
by
Alerte COVID
highlighting that the
est
COVID
pleinement
Alert app
fonctionnelle
is
au
fully
Québec
functional
depuis hier
in
soir.
Quebec and
Et
has
pour
been
ça, je
since last night.
remercie la
And
collaboration
for that,
de nos amis au
I
gouvernement
would
du
like to
Québec.
thank our
Avec
friends
plus
in
de
the Quebec
600
government for their
diagnostics de
cooperation.
COVID-19 insérés dans l'application, ce sont
More
des
than
milliers de Canadiens qui ont
600
reçu une
keys have
notification
been
d'exposition
inserted into the
et qui ont
app,
su
and thousands of
d'aller se
Canadians
faire
have
tester
thereby
et de s'isoler.
received the
J'encourage les
recommendation
Québécois
to
et
go
tous
get
les
tested
Canadiens à
and to
télécharger
isolate. I encourage all
l'application
Quebecers and
aujourd'hui.
Canadians to download the app today.
Aujourd'hui aussi, les ministres Anand et Hajdu
Today
annoncent
also, Ministers
que le
Anand
gouvernement
and
du
Hajdu are
Canada
announcing
a
that
signé
the
une entente
Government of
avec
Canada
Abott
has signed an agreement
pour
with Abbott
20,5
for
millions de tests rapides
20.5
de détection
rapid
d'antigènes
tests,
COVID-19 Panbio.
which are
Grâce
antigen
à cette
tests
entente,
from
les
called
provinces pourront faire
Panbio.
plus de tests
Thanks to this agreement,
plus rapidement. Les
provinces
cas
will
de
be able to carry out
COVID-19
more
pourront être
tests more
décelés
quickly.
plus rapidement
Cases
et
of
tous ceux
COVID-19 will
dont
be
les
spotted
résultats sont
quicker,
négatifs
and
pourront retourner
everyone
le
with a
plus
negative
rapidement
result will be
au
able
travail
to go back to
ou à
work
l'école,
or
par
to
exemple.
school as soon as possible.
Encore une fois, merci de vous joindre à nous.
Once more, thank you
Et
for
je
being
vais
with us.
maintenant céder la parole
And I will
à
now
ma collègue Patty
give the
Hajdu,
floor to my
la
colleague
ministre
Patty
de la Santé.
Hajdu,
Patty?
the Minister of Health.
Merci, Dominique, et
Patty,
bon
thank
après-midi. Dans un
Dominic.
premier temps,
Good afternoon.
j'aimerais dire merci au
Firstly,
gouvernement du
I
Québec
would like
pour
to thank
avoir
the
fait le
Quebec
choix
government
de
for
l'utiliser
having chosen
l'application
to
Alerte COVID.
use the COVID
J'encourage
Alert
toutes les
app
Québécoises et
I
tous les
encourage
Québécois
all
à la
Quebecers
télécharger.
to download
Nous
it.
sommes à 3,5 millions
We are up
de
to 3.5
téléchargements
million
et il faut
downloads,
continuer à
and we need
augmenter
to
ces chiffres.
keep increasing
So
that
please
number.
download the COVID Alert app today, especially those in Quebec. I'm glad to share that Health Canada confirmed this morning that they have approved the first antigen rapid test, the Panbio test from Abbott. As Health Canada officials shared with you last week, antigen tests are expected to have a few advantages, including being easier to perform with limited training and being able to be done at the point of care with generally more rapid results. The Panbio test is quick and easy to use, and the results are available in about 20 minutes, sometimes even less. And antigen tests will be valuable tools for residents of remote or isolated communities or in special settings. They could also have a role to play in avoiding large cluster outbreaks when results are rapidly needed to avoid further spread of the virus. So before turning to my colleague, Minister Anand, who will share details of Canada's order for this test, I would like to remind Canadians to consider a virtual celebration this Thanksgiving. As everyone knows, it's been a challenging week, and virtual dinners, although less appealing, rather than an in-person gathering, can make a difference in reducing the spread of COVID. Saying no to friends and close ones is an act of love. So I will say to Canadians, I will join you in this, and it is a difficult time, I know, to be apart from family, but I think it's an important step that we limit our contacts. And with that, I'll turn over to Minister Anand.
Thank you, Patty. Good afternoon. As parts of our country confront rising COVID-19 infections and are faced with renewed restrictions, I strongly echo the advice of our public health officials. We have to double down to help slow the spread of the pandemic. This means having discussions with our families about social distancing, staying home, and wearing masks. Mon ministère, Service Public et
My
Approvisionnement
department,
Canada,
Public Services and
continue
Procurement
sans cesse
Canada,
à déployer
continues
des
round-the-clock
efforts visant
efforts to
à
procure
acheter de l'équipement de
vital
protection individuelle
personal protective
ainsi que
equipment,
d'autres fournitures médicales
other medical
essentielles, des
supplies,
traitements et des
as well
candidats
as treatments
vaccins.
and vaccine candidates.
Procurement of tests to detect COVID-19 has been and continues to be central to our fight to contain this virus. We know that cases are on the rise, making testing and tracing more important than ever. And the federal government is here to support the provinces and territories in this central effort. Plus tôt cette année,
Earlier
nous
this
avons
year,
été en mesure de
we
nous
were able
procurer
to
1,2
procure
million tests
1.2
rapides de
million
Cepheid et
Cepheid
100
rapid
dispositifs
tests
GenExpert
and 100
d'Intermedico
GenExpert
aux
devices
fins
from Intermedico
d'utilisation dans
for
les
use
collectivités
in
du Grand Nord.
northern
In
communities.
addition, we have contracts with bioMérieux Canada for nearly 700,000 of their rapid tests. These and the contract for Abbott tests announced last week are just some examples of the federal government's efforts to supplement the current standardized testing regime. In terms of our announcement today, I, with my colleagues, are pleased to announce that we are adding to the lineup of rapid tests that we have procured. The Government of Canada has signed a new agreement with Abott Diagnostics to purchase a total of up to 20.5 million antigen rapid COVID tests, which can be analyzed on-site without additional equipment, with results in about 20 minutes. This is in addition to up to 7.9 million ID Now rapid tests that Abbott will provide. In addition, the federal government has procured enough swabs, reagent, and other materials to conduct 200,000 tests per day in Canada for at least the remainder of the year. However, as we have seen throughout this country, challenges persist in scaling up laboratory capacity to process the increasing number of samples in the required time. Beyond providing rapid turnaround for results and much needed capacity in northern and remote parts of our country, these point-of-care tests are crucial to expanding testing capacity more generally, because these samples can be analyzed on-site and do not require transportation to a lab to produce results. To be clear, the strategy in terms of our procurements is not to replace the standardized testing model, but to enhance the capacity of provinces and territories to keep up with the increasing demands for tests. Hence, our procurement strategy is one of diversification across various testing types and models. On behalf of the Public Health Agency of Canada, our work to procure a range of tests is ongoing, and we are on track to purchase additional types of rapid tests in the coming weeks and months. In closing, we are all living with pandemic fatigue, but please be assured our government is steadfast in its commitment to your health and your safety. Nous ne cesserons pas
We will
nos
not
efforts
cease
visant
our
à fournir de
to
l'EPI
procure
de base à nos
PPE
travailleurs
essentials
de la
to
santé
our
de
frontline
première
healthcare
ligne
workers
et à nos fournisseurs de
and
services
providers of
essentiels.
essential
Nous ne
services.
cesserons pas
We
nos
will not
efforts
cease our
visant à nous
efforts to make
assurer
sure
que
that
les Canadiens
Canadians
aient accès
have
à un
access
vaccin sûr
to a
et
safe
efficace.
and effective
Et nous ne
vaccine.
cesserons pas nos
And
efforts
we will not
visant
cease our
à
efforts
procurer des
to
tests
procure
de dépistage de
COVID-19
la
tests
COVID-19 pour les
for
Canadiens.
Canadians.
Nous ne battons pour
We are
vous
fighting
et
for you
à vos côtés
and
pour que
alongside
notre
you
pays
to
puisse
make sure
se
our
hisser
country
de l'autre côté
gets
de
through to
cette
the other side
pandémie.
of this pandemic.
We are fighting for you and alongside you to make sure our country gets through this pandemic and emerges on the other side. Merci beaucoup.
Thank you very
Miigwech.
much.
Thank you so much.
Thanks, Anita. Dr. Tam?
Good afternoon, good day. Bonjour à toutes et à tous. There have been 168,960 cases of COVID-19 in Canada, including 9,504 deaths. Over the past week, labs across Canada have tested an average of over 71,000 people daily, now with 2.5% testing positive. National daily case counts continue to increase, with an average of 1,951 new cases being reported daily during the most recent 7 days. At the same time, we are monitoring closely an upward trend in the number of individuals with COVID-19 requiring hospital care. Over the past week, there have been an average of 613 COVID-19 cases in hospital on any given day, and 16 deaths reported daily. Thanksgiving is a special time for many Canadians, a celebration centered on visiting and enjoying meals with families, friends, and neighbors. University students travel home, and faith groups gather in thanks. People often head indoors as temperatures drop and the weather becomes more unpredictable. We will be able to return to these cozy indoor gatherings one day, but while we live with COVID-19, we all need to think carefully about our Thanksgiving plans this year to protect ourselves, our loved ones, and communities. This is very hard because friends and families give us comfort. It might feel safer to gather with them, but this is in fact a false sense of security and can increase the risk of COVID-19 for those you love the most. There is a great illustration by New Zealand-based Susie Wiles and Toby Morris that I tweeted out this morning, and I'm hoping you are able to view this through media today. It shows us how quickly one case can become many in the absence of controls. It also shows us how the choices we make as individuals can have a big impact that will help to keep case numbers low. There are in-person activities we all need to do, and there are others we can live without. By limiting our number of close contacts, we can all help to slow the spread of COVID-19 and help essential services, businesses, and educational facilities remain open. Wherever you live, this year's cornucopia needs to include an abundance of personal protections and a set of virtual or safe distancing connections. Gathering indoors will be safest if they only include household members, especially where infection rates are highest. Gatherings outdoors that involve people from outside our households will be safest if well spaced. Remember, too close is too close, even if you are outdoors. Don't share food or objects. Bring your own is safer. Do share friendships, experiences, and the great Canadian outdoors together apart. Just have to say that I may have to leave a little bit earlier, but Dr. New is here to answer any questions if I'm not here. Thank you.
Bonjour à toutes et à tous.
Good afternoon, everyone.
Il y a eu
There have been
168 cas de COVID-19 au Canada,
168,960 cases of
dont
COVID-19 in Canada,
9,504
including
décès. Les laboratoires dans
9,504
l'ensemble
deaths.
du Canada ont fait
Over the
l'analyse
past
des
week,
tests de
labs
dépistage de
across
plus de
Canada
71
have tested
000
an average of
personnes
over
par jour en moyenne
71,000
au
people
cours de la
daily,
dernière semaine, dont
with
2,5% ont reçu
2.5%
un résultat
testing
positif.
positive.
Les chiffres quotidiens nationaux
National daily
continuent
case counts
d'augmenter.
continue to increase,
1951
with an
nouveaux
average
cas
of
en moyenne ont été signalés
1,951 new
quotidiennement
cases
au cours des
being
7 derniers
reported
jours.
daily during the
Par la
most
même
recent 7
occasion,
days.
nous suivons de près la
At the same
tendance à la
time,
hausse
we are
du nombre de
monitoring
personnes
closely
atteintes
an upward
de la
trend
COVID-19
in the number of
nécessitant des soins
individuals with
hospitaliers.
COVID-19
Au
requiring
cours de la
hospital
dernière
care.
semaine, il y a
Over
eu
the past
en
week,
moyenne
there have been an
613
average of
cas de COVID-19 dans les
613
hôpitaux
COVID-19
et 16
cases
décès
in hospital
signalés
on any given
quotidiennement.
day and 16
L'action de
deaths
grâce est
reported
une
daily.
fête importante pour de nombreux
Thanksgiving
Canadiens.
is a special
C'est une
time for many
activité festive
Canadians,
pendant
a
laquelle ils
celebration
visitent leurs
centered
familles,
on
leurs
visiting
amis
and
et leurs
enjoying
voisins et
meals with families,
avec
friends,
qui ils
and
partagent
neighbors.
un repas. Les étudiants universitaires
University
retournent à la
students
maison
travel
et des
home,
groupes confessionnels
and faith
se réunissent
groups
pour
gather
souligner
in
leur
thanks.
gratitude. Les gens se réunissent
People
souvent à
often head
l'intérieur,
indoors
étant donné
as
que la
temperatures
température
drop
se refroidit et que les
and the
conditions
weather becomes
météorologiques
more
deviennent
unpredictable.
plus imprévisibles. Nous pourrons
We will
recommencer
be
ces
able
rassemblements
to
chaleureux
return
à
to these
l'intérieur
cozy
un
indoor
jour.
gatherings one
Mais
day.
pendant que la COVID-19
But
sévit,
while we live
nous
with
devons tous
COVID-19,
cette année
we all need to
réfléchir
think carefully
soigneusement à nos
about our
projets à
Thanksgiving
l'action
plans
de
this
grâce
year
afin de nous protéger
to
et de
protect
protéger
ourselves,
nos proches
our
et
loved
nos
ones,
collectivités.
and our
C'est
communities.
très difficile car
This is very
la
hard
présence de nos amis
because
et de notre
friends and
famille
family
est
give us
réconfortante.
comfort,
Il pourrait sembler
and it might
sécuritaire
feel
de se
safer to
réunir
gather
avec
with
eux.
them.
Toutefois, il
But this
s'agit d'un
is,
faux
in
sentiment
fact,
de
a false
sécurité
sense of
qui peut
security
augmenter le
and can
risque de
increase the
contracter la
risk of
COVID-19 pour
COVID-19
ceux qui vous
for
aimez
those
le
you love the
plus.
most.
Dr. Tam a affiché ce matin sur Twitter
This morning,
une
on
excellente
Twitter, Dr.
illustration
Tam
de Susie Wiles et de
published
Toby
an
Morris
excellent
de la
illustration
Nouvelle-Zélande
by
que
Susie
j'espère que
Wiles
vous
and Toby Morris
pourrez
of New
voir dans les
Zealand,
médias
and I hope
aujourd'hui.
that you are able
Cette
to view it
illustration
on
montre
social
comment
media today.
rapidement un
This
cas peut se
illustration shows us how
multiplier
quickly
en
one
l'absence de
case
mesures de
can become
contrôle.
many in the
Elle nous
absence
montre
of
également
controls.
comment nos choix
It
personnels
also shows
peuvent avoir
us
des
how the
répercussions
choices we make as
considérables qui
individuals
nous
can
aideront
have
à
a
limiter
big
le nombre
impact
de cas.
that will help to keep case
Il y a
numbers
des
low.
activités en personne que nous
There
devons
are
tous
in-person
exercer
activities
et
we
il y
all
en
need
a
to do,
d'autres dont nous pouvons
and
nous
there are
passer.
others we can live
En
without.
limitant nos contacts étroits,
By
nous
limiting
pouvons
our
tous
number
aider à
of close
ralentir la
contacts,
propagation
we
de
can
la
all help
COVID-19
to slow
et
down
faire
the
en
spread
sorte que
of
les services
COVID-19, which will
essentiels,
help
les
essential
entreprises,
services,
les établissements
businesses,
d'enseignement
and
demeurent
educational
ouverts.
facilities to
Peu
remain
importe où
open.
vous habitez, la multitude
Wherever
de
you live,
célébrations de
this
cette année
year's
doit
cornucopia
inclure une
needs to
abondance de mesures
include
de
an
protection
abundance of personal
personnelle et
protections
des arrangements
and
pour
a
établir
setup
des
for
liens
virtual
virtuels
or
ou à
safe
une distance
distancing
sécuritaire.
connections.
Les rassemblements
Gathering
intérieurs seront
indoors will
sécuritaires
be
s'ils
safest
comprennent seulement les mesures
if
de ménage.
only
Les
household
membres
members are
membres
included,
du ménage, en particulier dans les
especially
endroits
where
où les
infection
taux
rates
d'infection
are
sont les plus
highest.
élevés. Les rassemblements
Gatherings
à l'extérieur
outdoors
qui comprennent des
that
personnes
involve
qui ne font
people
pas
from
partie de
outside
notre
our
ménage
households
seront
will
plus
be
sûrs qu'une
safest
bonne
if well
distance est
spaced.
maintenue. N'oubliez pas,
Remember,
trop près,
too
c'est trop
close
près,
is too
même
close,
si vous êtes à
even if
l'extérieur.
you are
Ne
outdoors.
partagez pas d'aliments
Don't
ou des
share
objets.
food or
Il est plus
objects.
sécuritaire d'apporter
Bringing
vos
your own
propres
is
choses.
safer.
Entretenez vos
Do
amitiés
share
et partagez
friendships,
vos expériences et
experiences,
les grands
and
espaces
the
canadiens.
great Canadian outdoors
Ensemble, à
together
distance.
apart.
Merci.
Thank you.
Merci beaucoup, Dr. New.
Thank you
Dr.
very
Tam,
much, Dr.
colleagues,
New.
so obviously we're happy to answer your questions.
Bonjour, nous allons commencer avec les questions au téléphone pour 3 questions avec une question de suivi chacun. We will start on the phones for 3 questions with 1 question follow-up each. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. The first question is from Mélanie Marquis-Lapresse. Please go ahead. Votre ligne est ouverte.
Question.
Merci. Bonjour. My
Thank
question
you.
is for
Hello.
Minister Hajdu. I know you spoke about this yesterday during your press conference with Minister Lametti and Quattro, but I just want to go back to those private clinics who offer testing in exchange, of course, of money because it's private. On its face, it pretty much seems like a 2-tier system. So have you spoken to your counterparts in other provinces about this?
Merci pour la question, Mélanie. Et,
Thank you for the question,
nous
Melanie.
avons une équipe Santé Canada
We
maintenant
have
qui
a team at Health Canada
investiguer
right
la
now
situation
that
avec
will
cette
investigate the
clinique.
situation
It's
surrounding
important
that
that
clinic.
I have the full facts before I speak with the health ministers across the country in terms of what's happening. But in principle, of course, we will defend equal access into a public healthcare system because that is one of the principles that our healthcare system rests on. But I am having a team at Health Canada look into exactly what the nature of these concerns are and what the nature of these services are, and I'll have more to say when I understand the details better.
Great. So could you just give me a sense of how long this inquiry could take? And secondly, articulate what could be the sanctions that the provinces expose themselves to. And it would be, I don't know, pretty rich on the federal government's part to, I don't know, cut transfers when the provinces are asking essentially for $28 billion or more in transfer because of the crisis.
Il y a des mécanismes pour Santé Canada d'appliquer les sanctions pour les contraventions de la loi de santé. It's important to note, though, that we need to have the details about what exactly is happening, and I'm expecting that I'll have those answers very shortly, so I can have a conversation with my colleagues across the country.
Prochaine question.
Merci, thank you. The next question is from Dylan Robertson from Winnipeg Free Press. Please go ahead, your line is now open.
Hi there. I have a question for the three ministers here because your offices and departments have been passing this one between the three. The Manitoba government says that back in the spring it had ordered 2 million N95 masks from an American company, but U.S. Customs had intercepted it at the request of the Canadian government. I want to know if the province is being truthful here and how often the federal government has intervened to stop provincial orders of PPE.
Do you have that answer?
Anita, do you want to?
Sure. It's an interesting question. I will say that we have been working closely with the provinces to facilitate their orders. And throughout the pandemic, if, for example, a province had asked us to assist with its delivery of goods that it had independently ordered, we were very enthusiastic about ensuring that, for example, that we would assist them with the transportation needed. So I am somewhat surprised by the information that you are revealing. I will look into it, but I am going to tell you right up front that on the contrary, our objective is to work with the provinces. I meet regularly with my provincial and territorial counterparts, ask them what they need, ask them how the federal government can be helpful, and put in place the mechanisms to get supplies, PPE, and the like to them as soon as possible. This happened with swabs in our northern communities, for example, and we will continue to facilitate and work with the provinces to get them what they need. Thank you.
Anita, Patty, do you want to add something?
No, I think that's fine. Thanks.
Yeah.
In terms of, you're asking me about in terms of the.
Well, there was some, Dylan had asked the question, I think there was some public confusion around whether we had redirected or something, some rapid testing that perhaps Manitoba or another province had ordered.
Yeah, so that was on the Abbott test, and there was some question, I think, by the Premier of Manitoba about why, why in fact Health Canada purchased all of the available allotment. We did that to make sure that A, we could get a good price for them, B, that we would be able to secure that amount of tests in a rapid way, and C, with the full understanding that they'll be deployed to provinces and territories according to the agreement right now that's being worked out, similar to that we have for personal protective equipment. And finally, that those devices will be provided to the province free of charge. So I think the Premier can rest assured that those tests will be available to Manitoba in accordance with the agreement that we negotiate.
En suivi?
Sure. I was actually going to ask about the Abbott issue, but that is a separate issue from the N95 mask issue. But I'm wondering if Manitoba isn't getting what it deems to be enough of the tests from the bulk order, if they're able to order that separately.
In terms of the procurement of tests and other large-scale items, for example, PPE, early on in the pandemic, we worked out a system that works very well across the country, which is that the federal government, with its buying power and its procuring power, ensures that we get the full allotment that would be available to Canada. It also prevents some of the duplication of requests from provinces. And in fact, and I'm speaking a little out of turn here, but the Minister of Procurement can correct me if I'm wrong, it also facilitates smoother purchases on behalf of the company that is actually selling the device. What we have done at Health Canada through the Public Health Agency of Canada is work with provinces and territories to ensure that we have a distribution agreement that allows for a distribution based on per capita and holds back a certain percentage of the equipment, or in this case tests, so that we can help supply additional equipment in the case of severe outbreaks or other kinds of requests for assistance from provinces and territories.
That's exactly right. And I will just add that our approach is to purchase in bulk the allotment that we are able to from companies like Abbott, so that then we can facilitate the distribution to the provinces and territories on the basis of the agreed upon formula that Patty is so usefully working with the provinces and territories on.
Thank you. Next question.
Thank you. Merci. La prochaine question est de Hélène Buzetti de Devoir. Votre ligne est ouverte. Please go ahead.
Yes,
Question.
my question is for Dr. Tam. If she's still in the room, I can't see it on my screen.
Yeah, oui, il est ici.
Oui,
Yes, she
merci.
is here.
So,
Thank
Dr.
you.
Tam, I wanted to ask you about the contact tracing app. I remember that at the beginning, when this idea was put forward, you were not super enthusiastic about it, and you were afraid of a false positive. And I'm just wondering, how afraid are you that this app could completely swarm the testing services that are already overloaded? We see in Quebec, in some cities, it takes up to 10 days to get a result, and we know that this app can sometimes tell you that if you've been in contact with someone because you happen to work just beside someone, but in fact there's a plexiglass separating both of you. So how concerned are you that this could create a problem rather than a solution?
Well, I think right now we're encouraging everyone to download the app, and in order to facilitate contact tracing, and especially when you're looking at the number of cases increasing, and a lot of the times you can't actually figure out the contact tracing fast enough. So I think the app is there to add another layer of tool that people can use. So we're encouraging people to download it. But it is just an additional tool because you actually have to do something with that result. At the moment, I think the opposite is true in a way, in that we need more people who have the positive test to actually use that key that they're going to be provided and input it into the device so that their contacts can be alerted. So that's not, I think, happening sufficiently, and that people need to do that. When that happens, of course, public health does have to then figure out whether the contact is a high-risk contact or not, potentially. So that investigation still actually has to take place, and testing will have to be done. So, but I think especially in areas like Ontario and Quebec, where there's difficulties, linking those contacts, it's an important added tool.
You mentioned that you still have to detect if it's a high-risk contact or not, but how do you go about doing that with the app? Because the government went out of its way to tell us that this is anonymous. We don't actually know who's the person behind the positive testing. So if you get a notification on your app that you've been in contact, how can you assess whether or not it was a risky contact? Will not be the consequence that everyone receiving a notification will get a test, and therefore there will be even more people getting tests?
Yeah, I mean, only the public. You have to contact public health, basically, and that is an added workload on public health. If there's a lot of people going out to big, gatherings, that's not what we want. We want those contacts to be low. So if you get a notification, you're going to have to link up with your local public health unit, which is an extra piece of work. They will then have to figure out essentially whether there's any specific risk and whether you need to get tested. So I think, the app itself is not going to tell you whether you're a high-risk contact or not, whether there's a barrier or not. So those were the limitations that were previously identified by medical officers of health. And as I say, it's not a perfect tool. And I think that as the rates of contact and the cases are escalating, it is an important thing to do as an added layer of protection. Would it put more pressure on the testing system? Potentially. But this is where, I think the local public health human resource is the other aspect that needs to be supported as well, because they're going to have to determine if, certain high-risk settings have occurred.
We will now come to the floor for 3 questions with 1 follow-up question each. Nous allons passer au plancher. First question.
Mia Rabson from the Canadian Press. Dr. Tam, the President of the United States yesterday suggested we should not be afraid of COVID-19 and we should not let it dominate our life. I'm just wondering if you have any response to that assertion.
So I think we have learned a lot more about this virus over the last months. And so we do know what to do. And the difficulty is having everybody try and keep up with public health advice. So I absolutely agree that we need to take control of the situation. There are tried and true public health measures that we know works. But with a sustained response, we need everybody to keep remembering what we just said, reduce your contacts, wash your hands, put on a mask, respect the physical distancing. And it is a very complex and tricky sort of months ahead. But we should take heart in the fact that we know so much more. There's more knowledge on how people can treat someone with an infection. We're working hard on all sorts of countermeasures, if you like, vaccines and other treatments. And we are having more tests, as you've just heard, that there's many more tools. So we should not fear the virus, but we do have to adjust our lives in order to manage our way through it. So I would say, yeah, it's not fear that we are sort of looking at. I think the way to look at it is agency, is taking your own control over the virus and the risk that you can safely manage. And that, unfortunately, sometimes that's a very individualistic risk assessment, but we've been trying to take people through that thinking process as well.
And I'm not sure if this will be for Dr. Tam or maybe Minister Hajdu or Minister Anand, but you've mentioned we have enough swabs and reagent to do tests, 200,000 tests by the end of the year, but lab capacity is the problem. So what are we actually doing on lab capacity? Are there federal labs that we can add help with? Anything specific on the lab side would be great.
Well, thank you. And it's a complex question. I think we could probably follow up with a bit of detail, but of course, we do have some federal capacity to support in cases of surge through the National Microbiology Lab and another potential mobile labs that are also helped by the National Microbiology Lab and the Public Health Agency of Canada. We have a rapid response program that I think the Prime Minister spoke about a couple of days ago, where we can pull together tools for communities that are in outbreak and that can provide additional assistance. But I think to your point, even more pointedly, is that we have a human resources challenge now in Canada. And in fact, what we're seeing around the world is that not only are we having a hard time keeping up with the pace in terms of the specialists and the healthcare workers that we need, but also the fatigue and exhaustion is a real challenge. We're hearing increasing reports of nurses, for example, on the front lines who are exhausted, public health workers, pharmacists, anybody that's a healthcare allied professional is reporting a higher degree of fatigue and exhaustion. And in fact, Minister LeBlanc will help us, I think, have a conversation in the next several weeks about the human resources challenge that is not unique to Canada, but certainly one that's being faced by countries all around the world.
Barry from CBC. I'd like to ask you about the reliability of the tests that you're announcing the purchase of today. I don't know how they compare to, say, the tests that are going to the labs right now. And I have heard that they said that even the company says that they cannot be used as the sole basis for treatment or other management decisions. So can you just talk about the reliability of them, where they fit into the, I guess, the testing regime?
I'll turn to the doctors first and then let them deal with the very precise medical questions.
Okay. So like you say, there's lots of different tests which are now coming out. So the gold standard that we all know and everyone's familiar with is what we call the real-time PCR test. And that one is still the most important test to use, especially when you need to get the diagnosis right. For example, an ill person in the ICU or a symptomatic person in a long-term care facility. You have to get the diagnosis right. You need to do that test. The challenge up to now in some situations is that you need to actually collect the sample and send it to a laboratory. And so the new game changer is the one that was just introduced a little while ago, is the Abott Rapid ID Now test. So that is also a PCR-based test. So that test, in terms of its attributes, sensitivity, and so on, is quite similar to the one that's sent to the lab, except it can be closer to what we call point of care. and done sort of on site. And that one I think is very important, especially if we're planning to use it hopefully in the near future in remote and isolated settings. So that one I think is pretty straightforward. The new one that's going to be introduced, the antigen testing, we're also going to be putting out guidance very shortly in terms of how that best is used to its advantage in terms of an overall testing strategy. It is a given that this test is not, this type of technology is not as good as the PCR-based test, but it doesn't mean it doesn't have certain advantages. As the Minister Hajdu mentioned, it is easier to use in terms of just from a training perspective. A lot more people can sort of actually administer the test compared to needing more sort of a trained technologists and experts to use it. So that's one thing. You can also give a very rapid test results as well compared to the other rapid test, which is the PCR one. So this is where it gets a bit confusing. So how do we use the antigen test? Well, in general, the guidance which will be coming out shortly looks at it that for certain types of settings where you can maybe make up for the drop-off in sensitivity because you'll be testing asymptomatic individuals in certain settings on a more regular basis. For example, let's say workers in a remote workplace site, or for example, in a very crowded facility like let's say a meatpacking facility. In those types of settings, because of the regularity of testing, antigen tests in general might have a useful place to be used in the overall testing strategy, and save the PCR test for those where you actually have sick people in which you need to get the diagnosis right. There's lots of other possibilities too in certain outbreak settings where you need to at least start rapid public health action. You could be using the rapid antigen test to quickly identify those who might have been exposed and maybe are actually infected with the virus. But then probably you might need to do work on sending it for a more confirmatory test with the PCR. But at least with the presumptive positive, you can start undertaking public health actions. So there's lots more to unpack, but those are sort of the main points in terms of how antigen tests could be used as a complement to the existing PCR.
I could just briefly in French on that, and then I've got a couple of questions for that.
Français, oui. OK. Oui.
I'll just keep going, don't worry.
OK, en général, on a des nouvelles technologies pour dépister les personnes avec la COVID-19. Le norme d'excellence, je ne sais pas en français, peut-être étalon d'or, c'est encore on dit le RT-PCR, Real-Time PCR. C'est vraiment pour diagnostiquer quelqu'un qui est symptomatique, peut-être dans une circonstance, si on a un patient dans une unité de soins intensifs ou peut-être une personne un aîné dans un CHSLD. C'est important d'avoir les diagnostics très précis et fiables. Maintenant, avec l'introduction des autres technologies, on a aussi plus de choix, plus de possibilités. Le test rapide de Abott ID c'est aussi basé sur le PCR. On a aussi l'avantage d'avoir les résultats plus rapides et aussi, comme on dit, point au service. Donc, c'est très utile. Peut-être, j'espère bientôt, on peut utiliser un point de service PCR, un test comme ça pour peut-être les communautés isolées, peut-être pour avoir un résultat plus rapidement. Et ce n'est pas nécessaire avec peut-être l'idée pour le transport des échantillons au laboratoire au sud.
Samples wouldn't have to be transported to a lab farther south in the country. We also have another technology for antigen detection.
Le test rapide pour des antigènes, ce n'est pas, se donne pas des résultats si fiables. La sensibilité est un peu diminuée comparée au PCR, mais c'est aussi des avantages on peut utiliser.
But those are also tests that can be used in certain circumstances.
Pour prendre avantage des autres caractéristiques. C'est aussi un test rapide pour avoir les résultats. C'est aussi un point de service. Et aussi, c'est très facile aussi, je pense que ça prend moins de formation pour quelqu'un pour appliquer, utiliser cette technologie. Mais je pense qu'on va, bientôt aussi disséminer des lignes directrices comment utiliser les tests d'antigènes. En général, je pense que dans les circonstances où c'est très important peut-être de tester d'une fréquence, peut-être toutes les semaines, peut-être les travailleurs dans les contextes plus isolés ou peut-être aussi dans une usine de transformation. C'est important de peut-être utiliser la technologie comme ça. Mais c'est sûr, si on reçoit un résultat positif, c'est toujours important aussi d'avoir un test de confirmation avec le PCR.
It is then important to use a PCR
Minister
test
Hajdu,
to
do you see
confirm.
this taking pressure off the existing testing system? And I guess, Minister Anand, when do you think you're going to get these new tests online?
I think every tool that we add to the toolbox in terms of options for testing takes pressure off a testing system in general. So as Dr. New has pointed out, for example, you could see this being used in a setting where, in my region, for example, a mining camp, where it's hard to get to a clinic, where it's hard to access testing, but where there's a high degree of risk if there's an outbreak, including to the Indigenous communities around those work sites. So, for example, if someone is symptomatic, you can rapidly test them on site and then determine based on the clinical assessment if they need a further PCR test, but it gives that assurance in that setting that you are actually doing a more thorough screening than what might be possible right now. That for sure will alleviate in long term the situation in terms of all our health systems, because of course the more that we can prevent in terms of outbreaks, the better it is for everybody, and the less contact tracing that goes on. For example, all of the public health measures that have to happen after an outbreak like that as people move around from the site to their communities.
And on the contract specifics, which is what I deal with every day, let me just break down the contract for you. I announced 20.5 million tests. We purchased outright 8.5 million, and we have options for 12 million more. We are expecting those 8.5 million tests before the end of the year. But as we just received Health Canada approval yesterday, we are finalizing the delivery schedule. The purpose of the options is to allow us to have some flexibility in terms of understanding how well that test is working, what communities it's working in, before we make a decision to go and exercise those options. From a contracting perspective, that's optimal. Hope that answers your question.
Thank you.
Next question. Global News. For Minister Hajdu and Dr. New as well, I'm interested in the Toronto Star story this morning about pockets of Toronto with positive test rates above 10%. I'm wondering if when that happens, something so high, do you get notified at the federal level? And are you aware of other cases like that? And why is that number so dangerous?
Let Dr. New start.
Okay, thank you very much for the question. So the first point about whether we get notified, yes, certainly we have very good communications. For example, Dr. Tam, myself, we're always in contact with our counterparts in the provinces and territories, the chief medical officers of health, as well as at the local level. So that would be Dr. DeVilla from the city of Toronto. Once there is, I think, a concerning situation, I think we have a nice tight community, I would say, in public health. And there's certainly all of our, I would say, our counterparts, our colleagues, certainly appreciate and know that they can call us anytime. So if there's something that we need to discuss from a public health perspective, what could or should be done, what could be done to support them from the federal perspective, well, we're certainly there for them. The 10% figure is something that's also been discussed at the international level, WHO and others, including ourselves here in Canada. Certainly when there's a, quote, a positivity rate in terms of the test done over 10%, that's very worrisome because that indicates there's probably a high degree of community transmission and lots of, quote, unlinked cases. And so that certainly means that public health authorities need to take whatever steps are necessary if they can identify high-risk events, certain settings that maybe need more intensive contact tracing. Those things are certainly things to be looked at. So I think the 10% is sort of I would say, quite a serious level. Even below that, we've been using the 5% level, saying that overall, it's good to keep sort of a positivity rate for lab tests below 5%. Once it's above 5%, it's something that you need to start looking carefully at what the local context and situation is. And certainly, as you're indicating, once it's over 10%, that's even more alarming.
I just concur with that, and it is an indication that more public health measures are needed, and that there is, uncontained community spread. So it's very alarming because, of course, the report is around specific neighborhoods in Toronto, but we know that people don't just stay in their neighborhood. People move about, and of course, bring the virus with them, and so it's actually quite alarming.
And my next question is, I believe, for Minister Anand, but if anybody else wants to weigh in. The tests that have been approved, I know that on Health Canada's website, there are a handful of point-of-care tests being developed here in Canada that are still under review. I'm wondering if Canadian manufacturers, do those get fast-tracked to the top of your list? And is there any update on those cases like Nanotech?
We'll get back to you with an update on the specific progress of Canadian manufacturers, but I'll just say, no, we expedite reviews of tests that look like they have promise in terms of meeting the criteria that Health Canada has set out. Obviously, speed is of essence here in terms of getting product out into Canada and into communities. I will also say that our standard turnaround time is 40 days from the time of submission. And in fact, this Abbott test was under that 40 days. But in some cases, manufacturers don't have the clinical evidence that needs to be provided to Health Canada to complete the review. And so the request goes back to the company. In fact, regulators will work with companies frequently on trying to procure that information in a way that then they can assess to assure its integrity.
And if I could just follow up from a procurement standpoint, our approach has been, as you've seen in the last two announcements relating to rapid tests, to put in place contracts that are contingent upon Health Canada approval. And so we are engaged with a number of suppliers for rapid tests at the current time. And we are seeking to put those contracts in place so that if and when Health Canada approval occurs, we can quickly execute on those contracts and have the deliveries coming in quickly. Thank you.
Perhaps just to add a more general comment, we had a conversation, a number of us earlier today, about this very issue, the importance of building up domestic manufacturing capacity. We saw the importance around personal protective equipment, and our colleague Navdeep Bains worked with a number of industry players across the country to improve Canada's capacity. That, I think, has been a success on the personal protective equipment. But we also understand the legitimate expectation that Canadians would have that where there is an approval and a promising test, for example, we would obviously want to work with the Canadian industry to see how we can also improve domestic capacity while respecting, obviously, the regulatory approval process and rigor. But if you can do the two together, then it's value added for Canada in terms of having a domestic source also. So we're working on those levels right across industry in every corner of the country.
And Dom, if I could just step in here, I've been thinking about the importance of clarifying the federal provincial framework in terms of deploying and distributing the rapid tests. And I want to make it clear that the federal government has not and will not be blocking any provincial orders. On the contrary, we will be facilitating the distribution of tests for provinces and facilitating their attempts to procure any items, PPE testing or the like.
And Anita, you also said, and including paying for it.
Yes,
Yeah,
we are here
which
for
is
the
not
provinces and territories.
which is not an inconsequential.
But on the
authorization.
record, I think it's really important to reiterate that we have not and will not block any provincial orders on PPE or any other items, including tests.
Thank you. We will move to the phone for two questions and back on the floor afterwards. Nous allons aller au téléphone pour deux questions, puis nous reviendrons au plancher. Opérateur, prochaine question.
Thank you. Merci. La prochaine question est de Catherine Lévesque, La Presse canadienne. La parole est à vous. Please go ahead.
Question
Oui, bonjour. Ma première question est pour
Hello.
Monsieur
My
Leblanc.
first question is for
En deux
Mr.
volets. Je veux juste
Leblanc.
revenir sur l'alerte COVID.
I would like to come
Donc,
back
il me
to
reste
the
l'Alberta et la
COVID alert.
Colombie-Britannique là,
So
qui
BC
n'ont pas
and
encore
Alberta
choisi
still have
d'utiliser
not
l'application. Je me demandais
chosen
où
to
en
use
sont
the app.
les discussions avec ces
I'm
deux
wondering
provinces-là et
where you
pourriez-vous
are
être
with
capable
those
de les
two
convaincre
provinces.
quand?
Will you be able to
Et
persuade them?
en plus de ça, j'aimerais savoir, bon, il y a eu
And
900 alertes
you said
en
there
2
were
mois. Qu'est-ce que ça veut
900
dire sur
alerts in 2
l'efficacité
months.
de l'application jusqu'à
What does that
maintenant?
mean about the application's effectiveness?
Alors, merci pour la question.
Answer.
En ce qui a trait aux
Minister
discussions
Leblanc.
avec les provinces
Thank
de
you for the
l'Alberta et la
question.
Colombie-Britannique,
Regarding
les
discussions
discussions
with BC and
se
Alberta
poursuivent.
governments, those
Évidemment,
discussions are
si on
ongoing.
peut avoir une circonstance où on a 10 provinces et
Obviously,
3
if
territoires
we
qui
could have a situation
adoptent
where 10 provinces and 3
l'application
territories
Alerte COVID,
adopt the
c'est
COVID alert app,
beaucoup mieux pour la santé publique de
it
ces
would be
provinces-là
much
et
better
pour le
for the
pays en
public health
entier.
of those
Alors, moi, je
provinces
suis
and the
confiant qu'on
country
va
as a
finir,
whole.
j'espère, assez rapidement avec une
I'm
circonstance où on
confident
a
that
toutes
we
les
will end
provinces
up
et
quickly
territoires
enough in a
ensemble
situation where all
qui
provinces
utilisent
and territories
l'application
use
Alerte
the
COVID.
COVID
Et qu'en
alert
ce qui a
app
trait
together.
aux indications de contact possibles,
And regarding
comme
the
la Dr Tam a
possible
expliqué, peut-être le Dr New pourra ajouter, mais le Dr
indications,
Tam, je
I
pense,
think the
a
doctors
bien
might be able
expliqué
to
il y a
add
quelques
to that
moments
question of yours, but
l'importance
I
pour les
think
gens
the
qui
doctor was
reçoivent
explaining earlier the
une test
importance
positive
of this app
d'ensuite
for people who receive
utiliser l'application en insérant
positive result.
les chiffres ou
It
le
is important
code
for them to then
approprié
use the
pour
app
ensuite
with the
activer
appropriate code,
la
entering that
notification,
code,
l'alerte
so that they
comme telle.
send
Alors,
out the code,
c'est un
as it were.
défi d'encourager les gens de télécharger
a challenge
l'application,
to persuade
mais
people to
ensuite,
download
pour
the
être
app.
conséquent, je pense que c'est aussi important que les
But
gens
I
qui
think it is
reçoivent
also
une test
important
positive
for
ensuite
people who receive a
utilisent
positive result
l'application
to then
précisément
use
pour
the
donner cette
app
fonction alerte. Je ne sais pas si Dr.
precisely
New
to
veut ajouter
send
quelque
out
chose.
the alert.
Non,
Would
pas
Mr.
vraiment,
Dr.
mais
New
ça,
like
on
to
peut
add
peut-être
anything?
ajouter le point
Dr.
que
New.
je pense que c'est idéal, c'est tous les
I
Canadiens,
think it's
n'importe où au
ideal
pays,
if all
peut
Canadians, no
utiliser
matter where they are
la
in the
même
country,
application. Parce que
use
même
the
ici, dans la
same
région
app.
capitale, ici,
Because even
nationale
here
du
in the
Canada,
national
à
capital
Ottawa,
region
et
in
je connais
Ottawa,
des amis qui habitent
I
de
know
l'autre côté de
friends
la frontière au Québec et
who live
Gatineau.
on the other
Et
side
c'est
of the
sûr que
border in Gatineau, in
les
Quebec.
gens de Québec traversent le pont pour aller à Ottawa,
And of
peut-être qu'ils
course,
se sont
people from
exposés.
Gatineau
Maintenant, c'est
cross the
facile pour
bridge to Ottawa.
les gens de Gatineau aussi à Ottawa, si quelqu'un s'est exposé,
It
d'avoir
would be
l'alerte
easy
sur le COVID,
for
sur
someone
l'application Alerte
who
COVID.
was
Et c'est
exposed
très utile. Et je pense qu'à un moment
to
donné,
find
on va
out
avoir
through the app.
l'application
It's very
pour
useful.
tout le pays. Je
I
pense
think the app
aussi
should
pour
be used
ajouter
across
le
the
point de
country.
Dr. Tam,
I
c'est
would
un
also
outil,
like
c'est
to
une
build
autre
on what
mesure
Dr. Tam said
supplémentaire, mais
earlier.
ça
This
remplace
is
par
an
vraiment le vrai
extra
travail
layer
de
of
traçage de
protection.
contact. Et je
And
pense que
it's very
c'est
helpful
très
with
utile parce
contact
que
tracing.
si la santé publique à l'échelle locale
It's so
a un
helpful
cas confirmé
because if
et la
public health
personne dit,
on a
ah oui,
local
OK,
level
moi,
has a confirmed
malheureusement, je suis
case,
allé dans un bar-restaurant avec beaucoup de monde. Je ne connais pas
and the
exactement avec qui
individual
j'ai eu une
says,
contact.
oh, unfortunately, I was
Avec
in a very
l'application
crowded
Alerte COVID,
bar
c'est possible que
or a
les autres
nightclub,
personnes,
and I don't know who I was
s'ils ont
in
reçu
contact with.
la notification,
Well, the other
ils contactent
individuals
la santé publique et la santé publique, les autorités
can
posent la question
receive the information
où
through
vous
that
étiez,
app.
les personnes disent, ah oui, si
And the
j'étais
local public
au
health
bar,
authorities
blablabla, et c'est
will
le même
let
bar que
them
le
know,
cas confirmé.
okay, if
Ça
you were
aussi, ça
present
aide
in
tout
that bar,
le
such and such a
traçage
time,
pour les contacts. C'est
they will
un
provide
exemple pratique.
the next
Merci.
recommendations. That's a practical example. Thank you.
Oui, ma question de suivi, en fait, c'est pour
Follow-up
Madame
question.
Anand. En fait, sur
My
la
question is for
distribution des tests rapides,
Minister
on
Anand.
sait, il y a le personnel de la
On
santé, il y a
rapid
beaucoup
testing, we
d'abstention
know
actuellement, il manque des gens. Donc,
that
à qui vont aller
there
ces
is
tests
a
rapides-là en
shortage
priorité?
of
Et est-ce
public
que ce sont
health
les provinces qui
staff.
vont décider des priorités ou vous pourriez là,
Will
imposer des conditions, par
provinces
exemple,
be
réserver
deciding
ces tests rapides-là pour les
on
communautés du Nord ou le
priorities
personnel de la santé, par exemple?
for where those tests are going to go? Will it be to northern communities?
Merci pour la question.
Answer. Thank you for the
Actuellement,
question.
ça c'est une question pour la ministre
Currently,
Hajdu.
that is a question for Minister Hajdu.
négocier une entente avec les provinces et territoires pour distribuer des épistages, and we'll work out that agreement together as we did for the personal protective equipment agreement earlier.
Prochaine question en ligne.
Thank you. Merci. The next question is from Émilie Bergeron, Agence QMI. La parole est à vous. Please go ahead.
Hi, my question is for Minister Hajdu. You mentioned 3.5 million downloads for the COVID Alert app. Can we have an update on the numbers of keys that were inserted in the app to notify of a COVID case? So basically, how many people from these users were notified because they might be exposed to COVID-19?
Dr. New has, I think, some precise statistics on that.
Yes, I do. What I can say, obviously, the numbers keep changing, but I think it's very encouraging. Obviously, we're getting close to about 3.5 million downloads. And at the present time, and this is probably from yesterday, 856 sort of a one-time keys were entered into the alert app. And as you can imagine, that lots of contacts probably associated with those. And even from Quebec, Quebec only went live, barely hours ago, and already 15 one-time keys were entered in the first few hours once the application went live in Quebec. Vous voulez en français ou ça va?
Would you like the answer repeated?
Non, ça va. En fait, je suis pas
No,
sûre
thank
d'avoir
you.
compris combien
In
de
fact,
personnes
I'm
ont
not sure I
été
understood
notifiées
how many
qu'elles auraient
people
pu être
got
exposées à
notified
la
that they might have been
COVID-19.
exposed
On
to
comprend qu'il y a des
COVID-19.
clés à
I
usage
understood
unique qui
that
sont entrées, mais
there are
combien de
one
personnes ont été
single-use
rejointes
keys.
avec ces notifications-là? Ça, c'était juste pour clarifier. Mais ma question de suivi,
My
c'était
follow-up
pour
question
revenir
now.
à une question qui a déjà été posée.
I would like to come back to a question that has already been
À quel point
asked.
c'est responsable pour quelqu'un qui a contracté la COVID-19
When someone
et un
contracts
chef d'État
COVID-19,
de dire qu'il ne faut pas avoir peur de ce virus-là et qu'il ne faut pas le laisser
how much responsibility
contrôler
does a
nos vies? À
leader
quel
of
point c'est
state
responsable?
assume when they say that we shouldn't
Peut-être je
be
peux commencer
scared
pour,
of a virus?
pour la dernière
Answer.
question. On ne sait pas parce que c'est
answer
une bonne comme aspect de l'application Alert
the
COVID
first
que
question first.
comme
We
dit,
don't
les
know
données c'est
because that is
anonyme, mais
a
on ne peut pas
good
comme lier
aspect of the COVID alert app, that it is
l'information
anonymous.
personnelle. On garde
So we
vraiment la vie
can't
privée.
know
Donc,
how
on
many
sait seulement
people
pour les
get
personnes qui ont
notified.
mis le code parce qu'ils
We know
ils
how
sont
many people
des cas
enter the
confirmés,
code
mais pour
because
le
those
nombre de
people are
personnes
confirmed
peut-être
cases.
se sont exposées, on n'a
But when
pas
it comes
des
to the
chiffres
number of
pour ça.
people who get notified, we don't have numbers for
Pour moi
that.
aussi, peut-être je peux dire aussi comme Dr. Tam que
I
je
can
pense que
also say
le contexte est important. C'est sûr
that
que tout le monde
context
ici,
is
même au
important.
Canada, partout dans le monde, il ne faut pas avoir
certain
peur
that
de la COVID-19, mais il
here
faut
in
être, comme
Canada
on dit,
and everyone everywhere in the
bien
world
informé avec
must be
l'information. Il faut
scared
bien suivre,
of
comme
the
on dit,
virus.
c'est
We
quoi
need to have the right information and we
l'évidence
need to
scientifique et c'est quoi
follow
les
the
consignes
guidelines.
importantes. Et je pense que
We need
tout le
to
monde ici,
stay
pour
up to
répéter,
date
c'est
on the
deux, trois,
guidelines.
quatre choses
And I
importantes.
think
Le port du
everyone has
masque,
learned by heart
la
the 3 or 4
distanciation
important
physique,
things.
lavage
Wearing
des mains,
masks,
rester à la
washing
maison
hands,
si vous êtes
staying
malade,
home,
même avec
social
des symptômes
distancing,
légers.
staying home even if
pas
you have
difficile. Et
mild symptoms.
c'est pas seulement une question d'avoir
It's quite easy,
l'information,
and
mais
it's
c'est
not
comment on
only a
utilise
matter of
l'information.
getting
Ça,
the
c'est la
information,
chose
it's
la
how
plus
we
importante.
use the
Merci.
information. That's the most important. Thank you.
Merci, thank you. We will come back to the floor for 2 final questions.
Bonjour, c'est une question pour Madame Hajdu, mais si
Question
quelqu'un
for
d'autre veut
Minister
répondre
Hajdu,
aussi,
but anyone else can
ça
weigh
irait.
in.
Quand on parlait des cliniques privées tout à
When you were
l'heure,
speaking
qui
about private
demandent
clinics
de
earlier
l'argent pour avoir des
that are
tests
asking for
rapides
money
plus
for
rapidement,
rapid
qui font
testing,
qu'on a un système de tests à 2 vitesses
which
finalement. Vous avez dit qu'il était pour
these
avoir une
make it
enquête.
so that we have a 2-tier system.
Quel genre
You said there would
d'enquête
be an
et quel genre
investigation.
de
My question,
sanctions?
what kind
Des
of
amendes,
investigation
fermeture de
and what
cliniques?
kind of sanctions? Would they be closing the clinics or fines?
Ce n'est pas une investigation
Answer.
formelle
It is not a
dans ce
formal
moment. C'est
investigation at
une
this time.
inquiry, je pense,
It's an
une
inquiry,
investigation
I think.
informelle
An informal investigation.
avec les officiels de Santé Canada.
With
Je dois
Health
comprendre
Canada
la situation
officials.
je dois comprendre le situation meilleure. Et,
I need to understand the
je vais
situation better.
retourner ici
And after that, I will
et
come
dire
back
les étapes prochaines.
and announce the next
In English,
steps.
on the same question about the sanctions that could be found if
We have, obviously, this government has strongly protected the principles of the Canada Health Act, which is that it is universal and equitable, and that there is, and obviously protected the idea that it should be about need, not ability to pay. And so if, I've asked Health Canada officials to determine what the nature of these clinics are, where they're operating and how they're operating. And then when I have that information, I will come back and let you know what the next steps are. The tools that we have in terms of managing these clinics are somewhat crude, but they do involve sanctions under healthcare transfers.
Ma deuxième question, c'est à propos de l'application COVID Alerte au Québec. Pendant plusieurs semaines, plusieurs mois, le gouvernement du Québec disait « Ah, c'est pas super l'application. » Là, maintenant, ils embarquent, ils disent qu'il faut tout le monde la télécharger. Quel dommage vous croyez que ça a pu causer, un, pour la propagation de la pandémie, et deux, dans l'esprit des Québécois?
Peut-être, moi, je vais commencer, le Dr. New, pour ajouter quelque chose. Je pense, dès le début, le premier ministre Trudeau a encouragé toutes les provinces et territoires de faire partie d'une seule application pan-canadienne. Il n'y a pas de doute, le Dr. New l'a bien dit, le plus de Canadiens et de Canadiennes qui téléchargent l'application, que ce soit au Québec, que ce soit chez nous au Nouveau-Brunswick ou ailleurs au Canada, le mieux que ça va être. Ce n'est pas l'outil parfait, mais ça fait partie des outils nécessaires pour les autorités de santé publique de comprendre la propagation et pour les gens, comme le Dr. New a bien dit, qui n'ont peut-être pas nécessairement eu un contact personnel ou identifié, mais d'ensuite recevoir une alerte qu'il ou elle était en contact potentiel et ensuite d'aller chercher des avis des autorités de santé publique régionale ou locale. On a compris les inquiétudes de toutes les provinces quant à la protection de la vie privée, des données personnelles. C'est pourquoi nous pensons que c'est une application qui rencontre les exigences très élevées, par exemple, de la commissaire à la vie privée. Dès le début, nous avons reconnu l'importance d'être sensibles à ça. Et nous sommes tout à fait enthousiastes de la participation du gouvernement du Québec et une meilleure façon de protéger les Québécois et les Québécoises dans le contexte. Je ne sais pas si Dr. New... Dr. New? My answer was so thorough that even the Deputy Public Health Officer couldn't add anything.
Final question, dernière question.
Hi, Mackenzie Gray from CTV News. My first question is for Ms. Hajdu and Dr. New. I was looking at the slides that Dr. Tam put up earlier, and it said on them that we should watch the game at home and order takeout. But in hotspots here in Ontario, like Toronto and Ottawa, you're able to go to the bar. In particular tonight, the NHL draft's on tonight. There's going to be a lot of people who are going to go eat inside. They're going to watch some sports. They're going to drink some beer. And that is contrary to the advice that Dr. Tam is giving out and contrary to the advice that all of you are giving here. So for Ms. Hajdu, why is there such a disconnect between what the federal government is preaching and what Ontario is allowing? And for Dr. New, you said earlier in the year that going inside to drink or have a beer or eat is something that you wouldn't do when the cases were much better. I asked you that question back then. The cases were much better back then, but surely now you must believe, Dr. New, that bars and restaurants in hotspots should be closed if back in the summer when things were good, you wouldn't be willing to go in there yourself.
So I'll start, and I think that our advice has always been to reduce our contacts, because as much as, we know that provinces and territories and local jurisdictions are working to try and get that balance right. Of course, it's an individual decision, but the less contacts we have, the less risk we have of sharing the virus with others. Having said that, we also know that the disease activity is different in different parts of the country. Where I live in Northern Ontario, I think right now we have 1 or 2 active cases in the entire region of my riding, which is Northwestern Ontario, but the eastern part. But that can change in a moment. And we know that, the safest thing for people to do right now is to really limit their amount of contacts. those decisions around whether or not a particular sector or a particular business or a particular industry needs to have restrictions placed on it are provincial and in some cases local. And we fully support those decisions at the federal level. But overall, our message has remained consistent and will remain consistent that your risk is reduced and the risk, therefore, to the people around you is reduced the less activity you undertake. And in fact, one of the surveillance tools that we monitor is mobility. How much are people moving around? To get a sense of how much more disease activity we might see. And in fact, we see that the more mobility there is, in fact, the more disease activity there is. So that's why we're reminding people on a regular basis to really reduce your contacts and really ask yourself whether or not this particular event is so important that you can't miss it, or whether you can say no out of an act of love.
Dr. New, do you want to go in detail on your social calendar for the next 7 days, please?
Yes, I could do that. But no, I think just to add to what Minister Hajdu said, I think first of all, in terms of what officials say from governments, I would say that of course we can say certain things at the federal level, but Canada is a big country, and so certainly we recognize our regional differences. So I would say at the end of the day, I would listen to your local public health officials. They're the ones who have to get sort of their finger on the pulse of what's actually going on in their jurisdiction. So here in the city of Ottawa, I listened to what Dr. Etche says, and she said, in terms of Thanksgiving, you should probably just keep it to your household, the actual people in your household. So I'm listening. I'll listen to her. The other point I think that's important to make is that it's a shared sort of responsibility in terms of both risk management and risk tolerance. And I would say, governments can do certain things in terms of regulations of what they do for certain sectors, be it bars, restaurants, and so on. But at the end of the day, it's all about individual behaviors. I think our Prime Minister even said a few days ago that, we're looking at the data right now, and it's concerning, but it's already been set. Up to the day before, the activities will determine what the data will be like probably for the next 2 weeks. So really, if you want to make a change 2 weeks from now, it's what we start doing today. So I think that's an important point to note as well. And then for me personally, I've certainly taken to heart the 3 C's in English, or on dit en français, vous évitez le bec, B-E-C. So in English, 3 C's, close contact, crowded places, close spaces. I could even add a 4th C in terms of continuous duration. So as you mentioned, all those 4 C's would apply in a sort of in a bar restaurant setting. If you're in a crowded place, closed space, maybe poor ventilation, and so on. No, I'm going to stay home and watch my sports in the comfort of my own home. And that's the same thing en français. Il faut éviter les étroits bondés, aussi les espaces, les contacts étroits, et aussi des
close
espaces
contact and closed spaces.
Même principe.
It's the same principle.
I understand, and Dr. New, you mentioned this as well, that these are provincial jurisdiction issues. But you are the national government. You are the health minister for the entire country. Dr. New, you're the deputy health minister for the entire country. And while there is a need to listen to local people, if we listen to Toronto, Dr. DeVille in Toronto says, close the restaurants. We need these closed now. There are too many cases coming from this, but the Premier will not grant that request. So are you saying, Ms. Hajdu, that as the national health minister, you will not intervene at any point in time, even if local officials are saying one thing and a Premier is saying another?
Well, I think the premise of your question implies that I would have a tool to intervene, and I don't. The federal government does not have authority over provincial governments in terms of those types of decisions. But I will say that we intervene all the time in the way that we work with provinces, territories, and local public health to make sure that they have what they need. So, for example, I've been in close contact with Dr. Davila and Mayor Tory over the last several weeks to ensure that we understand what they need to help contain their outbreak. I regularly communicate with Minister Elliott to get a sense of what she's proposing in terms of the next steps for the province of Ontario. And that's the way that I intervene as a health minister. And in fact, the work that I do, I believe, at the ground level with local public health offices and units is some of the most valuable work, because I get from the ground level a sense of what's going well and what's going wrong. And I must say that's helped inform my decisions and my advice to my colleagues around the COVID cabinet table and cabinet at large.
Merci, ceci met fin à notre conférence de presse. Thank you, everyone.
terrifying.